Welcome to Medical Confessions.
Your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about ticks and Lyme disease and all the other tick-borne illnesses that are out there. Seems to be in the news a lot lately, and I knew nothing about tick-borne illnesses other than Lyme disease, and so I was pretty excited to find out there's a lot of them.
Excited. I don't know if it's something to get excited about. I think it's scary.
Yeah.
It is scary.
Yeah.
The more I read about it, the more terrified I became of ticks. I was like, oh my god.
Well, and I was happy to pass on like my fear and phobia to you too, because I told you guys that we had a tick event in our house last year. Our son just gently rubbed the back of his head and kind of cried out in pain, and then sitting there looking at it, there was just this nasty, gross tick full of blood in the back of his head. And my husband and I, who are both medically minded, kind of freaked out for a minute because we knew Lyme disease and we weren't sure what the right way, so we went full on like living room surgery, Google, figured out how to deal with it, and the research freaked us out. Like,
yeah, it's
big time.
Yeah, it's scary if you don't take care of it right away. What can happen?
Well, and I think that I had taken comfort in being from the Pacific Northwest. Like, I just assumed this isn't a tick area. This is like a, northeast area, Midwest maybe, but I had never assumed that we were going to be in a tick-infected area, and apparently we are. So
we are, and it depends on the type of tick, what you're going to get. But like you said, it's mostly in the Northeast and on the East Coast. So when it comes to like Lyme disease and stuff, super rare. And when it is rare, usually it's a pretty mild thing. It's only those long-term Lyme disease and the stuff if you don't take care of it and you just leave it on them for long periods of time. But
right.
I think even now it's pretty, in our state anyway, up in the Pacific Northwest, not that big of a deal. But the ticks are out there, so you got to get rid of them when you see them. The problem is trying to see them.
The CDC estimates that there's over 329,000 cases of Lyme disease each year in the U.S. It was primarily an East Coast phenomenon in the beginning. It has since been reported in all states except to Hawaii.
Another reason to move to Hawaii, I feel like.
Seems to be the tropical paradise,
Another reason why it's the perfect place to live. Well, and I guess the big thing too, like, what is a tick, right? And my understanding is it's an arachnid, so closer related to like a spider. And I had always assumed that they were kind of like a mosquito. Like, I thought that ticks fly, and it turns out they actually do what they call as questing. So they land on blades of grass, and they just wait to be picked up by something. Mm-hmm. And then they survive by...
How lazy.
I know. Like the worst kind of bug, really. But it sounds like once they grab on, they feed on blood from mammals, and that is their whole goal in life, to be picked up. And so like pretty much a useless insect, at least like bees and spiders, and you can come up with redeeming quality, but for ticks, I'm not seeing them.
Sounds like some people I know that just lay around and waiting for other people to take care of them.
Just grab on, no more leeches. Like, at least leeches have useful qualities. Let's call them ticks from now on. He's just a tick.
And they're not insects, they're arachnids.
Arachnids, yeah.
Crazy.
Yeah. But it sounds like there's only a handful that actually carry diseases. Is that what you guys had also discovered?
Well, it depends. Define handful. There's a ton of different types. There's one. I found 6 or 7 different types of ticks, and they all come with different types of bacteria and parasites. So really, what's going to be the problem, right? They're transmitting this bacteria to you, and in some cases, parasites. And then depending on which bacteria it is and which parasite it is, the different types of ticks will carry the different types of bacteria. So. And then if they latch onto you, there's a chance it'll get to you, but it's not always 100% of the time. And if you take care of it right away, it's not going to be a problem at all anyway.
Well, and I think the trick, though, is how do you determine, because typically when you get a tick bite, you won't feel it.
Yes.
And so when I was doing my research, I found out that April and I had a good laugh about this already, that the little phrase, check you for ticks, like the places that ticks like to grab on and hide away and are pretty gross. Like your belly button was one that I read, armpits, behind your knees, also in between your legs. So
some of them are gross and some of them aren't.
I think, like with my son's case, it wasn't the tick bite itself, but that the tick had been feeding long enough to be engorged in blood. And it was actually like bumping the tick that had already kind of encapsulated its head in his skin. So that's what made it sore. So if you have a tick that lands in a spot that no one's going to notice, like in the hair, which is what his was, and you're not bumping it or anything, you may go 24 hours. What is it, 24 to 36 hours, they say, of your...
Yeah, I found different numbers. The CDC had different numbers than the World Health Organization and the National Institute of Health, but all of them, somewhere between 36 and 48 hours was one. One was 24 to 36 hours. They have to be on you for that long before that bacteria starts getting transmitted to you with those parasites. So the time frame, who knows specifically, but somewhere in that 24 to 48 hour range. It's got to be on you for a while.
Yeah, well, I always hate when they give you like 24 hours until this happens or whatever, because what if you're like 23? What if you're 20? You know, like I just get really annoyed when they give really specific times. But so the trick is to find them early.
Check yourself, yeah.
Check yourself. Well, and then like knowing whether or not you're at risk at it. Like I wouldn't have assumed, you know, on our own property, we weren't necessarily in the woods in the days around when my son got it, but just having pastures with longer grass, I didn't realize that was such a risk factor.
Well, and did you get to see which type of tick it was?
Okay, so that's the funny part. I have a microscope, which I like to look at things probably more than my kids do. And so as soon as we removed it, I wanted to look at it under the microscope, also to make sure that we got like the full head and the little barbs, which typically get stuck in there. And so we looked it up. I don't remember the type it was, but it didn't appear to be a deer tick or one of the more, you know, scary ones, but it was definitely brown, which wouldn't have been easy to see. But we've seen them on our animals, and they're white, the ones that we've caught on our animals, and they're a lot more obvious, especially with dark-haired animals. So, no, I didn't specifically identify that type, but it didn't look like one of the really nasty, scary ones.
Well, and everything I read on it was, you know, the ones that are going to be the problems are the juvenile ticks, because they're so small, they're the size of a sesame seed.
Is that the nymph stage with the tick?
I don't know the life cycles of
so there's there's like the egg, the larva, the nymph, I think, is like the juvenile before it gets fully grown, if I remember right.
Well, I just know that everything I read was be careful about the juvenile ones because they're so small that you don't even see them on you. And so you're not even going to notice that they're there, and you don't feel the bite, so it's going to be on there for a lot longer. So the right answer is if you're in an area that you're worried about ticks, you really do got to check yourself. My favorite was that even the CDC was like, bring a mirror into the bathroom with you and start checking all of the places that you can't see, or have somebody come and check for you.
And that's what's so scary to me is like if you're in an area that you have to worry. Well, clearly we're already in an area,
and that's what I think was most terrifying for me is I didn't think we were at risk, in the Pacific Northwest, and apparently we are.
Yeah, well, and I've never checked myself for ticks.
Well, define risk, right? Like I've never checked myself for ticks, but I don't know if I've ever had one. I'm clearly not.
But you could walk through my pasture and you could have a tick.
I guess so, but like you said, when you look at the overlay of the maps of where all these different types of ticks are that carry the problems, it's all northeast, east, a little bit in northern California, but Pacific Northwest, there, you know, sure it's been reported, but you know, it's not very common.
Yeah.
The risk is pretty low.
It only takes one.
It does only take one. There's, you know, different types of ticks. So some of the big ones, your black-legged tick, which is going to be your deer tick. That's the one that's going to give you Lyme disease. There's a Lone Star tick, which I thought was pretty exciting.
Is it huge? So like a big Texas tick?
No, just looking at the pictures, these things aren't, I mean, they're all small in my mind, right? They're pretty tiny things to see. Once they start eating and engorging themselves, they get a little bit bigger. But
and I think females tend to get bigger from what I read.
Like, than the males?
Yeah, the females get really like twice as large as normal or whatever.
Well, and what I don't...
Unfair.
Well...
It's just like humans. Tick takes a day off from eating blood and it automatically drops like 10 pounds.
And they're lazy anyway.
Yeah.
Sitting around. There's the American dog tick. There's the brown dog tick. There's a groundhog tick. Who names these things? I don't really even know.
Well, that was clearly like a, you know, very boring scientist.
Yeah, well, then they all have their scientific names, and I won't bore people with the specific ones, mainly because I can't pronounce half of them. There's also like the Gulf Coast tick. All of these ticks, the reason why they're important is the different types of bacteria and parasites that they're going to be transmitting to you. So All of them come with pretty much the same symptoms, though. Unfortunately, it's kind of like flu-like symptoms, which is one of the problems with recognizing the ticks early, is because even if it's on you and you start getting these weird symptoms, the docs can't even really diagnose you with that unless they knew that, unless they were actually looking for it, right? After they've been on you for long periods of time and you're into that late stage of like a Lyme disease or something, then they can do blood tests and actually test for it. But in the early stages of Lyme disease, it won't even show up on blood tests sometimes. Sometimes it will, sometimes it won't. But the symptoms are all pretty benign, right? They're like fever, headache, body aches, stiff neck, fatigue. I mean, if we saw somebody like that, we'd say you got the flu. Deal with it. And I wouldn't even think of ticks, but we are in the Pacific Northwest. If we were on the East Coast, maybe that's more of a thing. But if you do, leave the tick on you for long periods of time and you get into some later stages, you can get some pretty serious stuff. You can get arthritis, you can get facial palsies, you can get slow and irregular heartbeats. I didn't read anything on the permanent facial palsy. A lot of these things go away with antibiotics, but sometimes the symptoms
Now April's scared. She's like, okay, now that it's going to make me ugly, I'm going to take this seriously now.
Some of the more serious stuff you can get inflammation of your central nervous system, so your brain and spinal cord can inflame. The first time I ever even thought about Lyme disease in the medical profession, was I was in medic school at the pediatric hospital, and there was a young lady who came in and she was unresponsive and had a swollen brain, and they didn't know why for weeks. And it wasn't until they were going to go ahead and do some surgery on her, and they shaved her head and they found the tick and took it off, and she was, unfortunately, it was too late for her. Her brain had swelled too much. It's kind of an interesting case. Either way, so some of these late stages stuff are pretty
severe,
scary and severe, but again, those are going to be so rare. But it can happen if you don't get that tick off pretty quickly. And then there's, some chronic Lyme disease syndrome, or some chronic syndromes that you can get where you get long-term muscle pain and joint pain and things like that don't really respond to antibiotics or anything like that.
So would that be Lyme disease specific?
Yes.
Yeah.
That one would be more of a Lyme disease issue. There's lots of, do we want to go into the specifics of the different types of diseases you can get from ticks?
And then, obviously I think Lyme disease is the big one that everybody hears. And for me, that just is a really scary sounding disease. I think people will spend months and maybe even years feeling sick before they actually get diagnosed. So this is kind of one of those ominous diseases that, oh yeah, I had Lyme disease. I think I've heard of a couple celebrities too that, like Selena Gomez, that like disappear for months and then you find out later she had Lyme disease.
Huh.
I did not know
that. Yeah.
I'm not much up on the popular culture like that.
Well, none of the Kardashians have had Lyme disease, so
So
I had to put it straight.
It always amazes me how much you know about celebrities.
I told you guys, like I read news feeds when I don't have social media, so that's what I do.
I saw an old couple in the store the other day, and the lady pointed out one of the magazines on the rack, and she's like, "Oh, like such and such. Did you look at that?" She's just talking about this celebrity like they are neighbors with her husband, and her husband was just right on top of it, like just into like they've known him for years and they're up on their business.
Well, it's weird what we pay attention to, because I, know somebody from Europe, and they said that the royal family is like nothing over there. It's not even in the news. They don't care.
Oh, really?
And here it's everywhere, which is crazy to me. And maybe he's just not into it. I don't know. But he was like, no, nobody gives a crap about the royal family. Who cares?
Is this Simon?
Yes.
Yeah.
Simon.
Simon's too busy studying everything else and becoming a better human.
Anyways, so let's go into some of the different ticks. There's the black-leg tick. That's going to be the deer tick. That one's the one that's can transmit Lyme disease. It can also transmit something called anaplasmosis, babesiosis.
It's like the Harry Potter diseases we were talking about.
I can't pronounce any of these things.
Yeah, you didn't even sound at all good.
Believable either.
It's just, you sounded
That
dumb.
one sounds fun.
Babesiosis. We can pronounce it like that, or babesiosis, however you want to go with that one, or Powassan disease. So Powassan disease. And again, all of these are going to be like different types of bacteria causing these things.
Right.
There's another one called the Lone Star tick. We mentioned that one. That one's going to give you tularemia and starry. There's the American dog tick. That one will also give you tularemia, and it'll also give you Rocky Mountain spotted fever. I've heard of that one.
Yeah,
before.
I've heard of that one.
I didn't know that was a tick-borne illness, but apparently it is. There's the brown dog tick, and that one also can transmit Rocky Mountain spotted fever. There's the groundhog tick, and that one's going to be your Powassan disease, is what that one will give you as well. So there's the Gulf Coast tick, and this one gives you one of those other Harry Potter-like spell diseases, Rickettsia parkeri ricketosis.
That's why I never read Harry Potter.
And I'm butchering that, so some doc out there don't yell at me for not pronouncing these right. Rocky Mountain wood tick is out there. That'll give you the Rocky Mountain spotted fever, Colorado tick fever, and tularemia. There's the soft tick, which will give you tick-borne relapsing fever. Sounds very generic.
Yeah.
And then the western black-legged tick, which gives you anaplasmosis and Lyme disease.
So the same diseases over and over across several different types of ticks. And is it true then that most of these will not be contracted until the 36-hour or later mark then? Yeah,
looking at all of these different diseases, they're all come with different incubation periods. So just a couple of examples. The anaplasmosis, it's got an incubation period of 1 to 2 weeks. If we get down to the babesiosis, that one's got a 1 to 9 week incubation period, which is crazy to me. And then, like we talked about Lyme disease, the tick's got to be on you for that 36 hours or so, but it also has an incubation period of 3 to 30 days. So some of these, things are coming down with the symptoms so far later that
right. You may never even connect that to the tick. Yeah.
The only one that I think you can maybe is this Rocky Mountain spotted fever, just because the symptoms are it looks like you've got spots all over your skin, so that one might be a little bit easier to diagnose, and its incubation period is a little less, 2 to 14 days. But again, the symptoms of all of these different ailments are all pretty much flu-like symptoms.
Right.
So would you really even go down that route to begin with unless you were looking for it? It's tough.
So I guess people are presenting with these, random generic symptoms, and then really until they see a doc several times or the symptoms don't go away, and then they start testing for specific things like Lyme disease and stuff like that, they wouldn't even be diagnosed.
Yeah, well, it's interesting you had mentioned the CDC and their 300,000 estimation. The health departments of the various states, when they were reporting to the CDC, they only confirmed 47,000 cases total nationwide. But the CDC did say they think it's a whole lot more than that, just because this is such a generic thing. And when you look at the overlay maps of the United States of all of these different things, the only one that comes close to the West Coast is this tularemia. And that's a lot in the Midwest, but everything else is a northern, eastern, or southeastern issue is where the large majority of them are. So if you're in those areas, be a little bit more concerned. Pacific Northwest, I guess we can just be scared by it.
The CDC is saying that Lyme disease is one of the fastest growing vector-borne infections in the United States.
I wonder if that's just because they're able to understand it better, because it's such a new disease in general. It wasn't until 1975 that they even were able to see that. And when I was reading it, it was kind of exciting. Most diseases are named after somebody, so I just automatically assumed there was some doctor named Lyme out there. But it turns out it was Lyme, Connecticut, I think. Where they
really?
Yeah.
Okay.
So named after the city, and that was because there was a huge uptick in juvenile onset of rheumatoid arthritis in the area, and they didn't quite know why, and it was this Lyme disease, and it can cause arthritis. So there it was, and they came down with it. And some of all the studies on the Lyme disease and how to even treat it are so new. Some of the ones I was reading was 2016, 2017, and most of them are treated with just antibiotics, because these are bacterias, most of them. And so then how do you even treat them, and which antibiotics to use? And that's just now being studied.
Right.
So it's pretty impressively new. So I wonder if it's such a prevalent thing now, because it is. Now people are looking for it and able to study it, versus before they didn't, and they probably called it flu or something else,
Right.
Yeah, they're saying that the diagnostic tools are still super unreliable, and there's no definitive cure for the late stage Lyme.
Yeah, that's...
Yeah, and I know with our son, so we ended up removing it, and of course we Googled the 1,000 different ways that the internet tells you to remove it, and I feel like we removed it with the probably most supported method, which is just tweezers all the way down as close to the base of the tick as possible, pulling it nice and steady straight out, and that's supposed to not traumatize the tick, so then they won't, expel their disgustingness into the wound. But it also most likely will remove the head and the barbs. We saw all kinds of things like putting Vaseline on it to suffocate it, mayonnaise, all these different things, but it sounds like they can actually go long periods of time without breathing. So the suffocation methods don't typically work, and it's better to just pull it out nice and steady. But we removed it, and then the soreness stayed for quite some time. We ended up finally taking my son, and we kept the tick, put it in a plastic bag like you're supposed to, or flush it. We kept it, took it in, and the docs here locally weren't that impressed. They were just kind of like, oh yeah, it's a sore, if it doesn't get better in a week or two. And it ended up getting like swollen and infected, which made us even more stressed out. But they never really were concerned about testing him for Lyme disease or anything, maybe because it's so rare here. Maybe if this was like one of the Midwest or the Eastern states, maybe they would have been a little bit more concerned, but they just weren't even really, and they kind of were like, yeah, and the diagnostic options are almost none, even with the tick in hand. They were like, yeah, we don't really have the tools to handle that, to figure out what, So it was kind of disappointing. I was like, oh.
What is it's like, AIDS in the 80s, right? It was this big scary thing, and then now it's like, okay, whatever,
right?
And maybe it's the same thing. It's so new, especially here. They're like, I can't really do anything. It's antibiotics is the treatment, and the symptoms are so benign. Unless he's get a swollen brain, let's not worry about it.
Well, and that's kind of what they said. Like, just keep an eye on him, and look. I guess you can get rashes that will spread out. It doesn't even necessarily mean it's Lyme. It could just be a reaction to the bite. But they were like, unless he starts coming down with any of these things, don't really worry about it, which he never did. So it was fine. But I could see how it would get overlooked, or it wouldn't be diagnosed properly for a long period of time.
So how are you going to prevent it, right? The ticks are everywhere, especially in the Northeast. What are you going to do to stop that? Most people say the same thing. Put on some insect repellent with at least 20% DEET in it, and that's going to help. If you've got a lot of clothes or, all your gear that you're using, because if you're out in the woods or whatever and you're hiking, you want something with at least 0.5% permethrin inside of it, and that's going to help keep the ticks off of there. But at the end of the day, that's just checking yourself and bathing once a day and checking yourself closely for it, and maybe having a friend come and check you, unless you've got a mirror and you can check out in all your nether regions and figure that out. But I've never checked myself for a tick, and I don't know if I ever, that's even a thing. But if you do see one on you, just like you said, take a pair of tweezers, pull it straight out, firm pressure, and if anything's left behind, dig it out like you would a splinter.
Yeah.
And if you can get it, before that 24-hour period, your chances of really having anything bad happen to you are pretty low. But if it's on there for long periods of time, you can get some of these pretty nasty things that can happen to you.
Right. So probably if it is engorged in blood and you don't know how long, probably a good idea to keep the tick. Keep a close eye on your symptoms, and then if need be, go in for pathology. And
yeah, and then hopefully the doc will put you on some antibiotics. But those people who have the chronic, Lyme disease, if they have that chronic muscle pain and joint pain and things like that, continued antibiotics has kind of been shown to not help. And so you're just kind of managing your symptoms, and that just sucks to have something that you can't really cure, and you just sort of, sorry.
So this isn't going to help any of our phobia here, but this story comes from Dr. Mike Paul. He explained that one spring day, he and his wife were called by a panicking pet parent who claimed that ticks were attacking her. The Pauls, the doctors, went to her home and were astonished what they saw. This woman was not exaggerating. We were able to see not a lot of ticks, but hundreds of ticks moving like an ancient army across the parking area. He's never seen so many free living ticks in an open environment.
It's like arachnophobia.
Yeah, totally. That creeped me out when I read that one.
Gross.
Ants running across your driveway.
I'm going to just do my little history bit. Tick and Lyme disease have been around for thousands of years. A recent autopsy on a 5,300-year-old mummy indicated the presence of the bacteria which causes Lyme disease. A German physician, Alfred Buchwald, I probably said that wrong, first described the chronic skin rash, or erythema migrans, of what is now known to be Lyme disease more than 130 years ago. Lyme disease was only recognized in the United States in the 1960s and 70s, and the bacteria that caused it, Borrelia burgdorferi, was officially...
All I think of is like Wingardium Leviosa from Harry Potter.
Oh,
yeah.
Look at you, Scott. That's masculine.
I haven't watched Harry Potter a lot. Kids growing up.
Luckily, you have children. We'll let it go.
Wasn't officially classified until 1981.
So I do have a funny story that has nothing to do with ticks but Harry Potter. But I was on a plane and coming back from Texas one time, and there's this guy sitting next to me, and he was watching something kind of like keeping it to himself, and I was watching something kind of keeping it to myself. And then at one point I watched, and he was watching Harry Potter, but at the time I was watching what's that movie with the girl and she has to fight to the death. She's a kid.
I know what you're talking about.
Hunger Games.
Hunger Games.
Yeah, and I was watching Hunger Games.
Yeah.
And I was like...
Did you both feel awesome?
Well, and so I was like, watching Harry Potter, and he goes, yeah, my kids want me to read the books, and I can't do it. I just got to watch the movie so I can at least have conversations. I'm like, thank God, that's why I'm watching Hunger Games, because they keep wanting to talk about it, but I'm not reading that crap. And I'm like, okay, cool. We're both grown adults. We've got a reason to be watching these things. And
Like,
we
so
bought each other a beer.
Likely stories, yeah.
But really, we're into it. Either way, we bought each other a beer. It was great.
That's funny that you say that, because I just started watching The Hobbit for the first time
Oh,
ever.
really?
Yeah, and I really liked it.
Those are good books.
Oh, well, I won't read the book, but...
My son wanted me to read the Hobbit books, and I'm like, I can't do it. That's a really thick book.
Have you read The Lord of the Rings?
Mm-mm.
What?
Haven't even seen the movies.
You guys.
I've watched the movies just because, my son's super into it, so we have, like, Lord of the Rings marathons all the time.
I'm going to. I love The Hobbit.
Yeah, they're great stories.
The problem is the extended version of the Lord of the Rings. We had this marathon one time, and he's like, let's do this marathon. Let's watch the extended version. I'm like, sweet. 14 hours, I think, total. We started in the morning. It was, like, late at night. It's a long series, because each movie's, like, 4 hours long with the extended scenes. And he's like, Dad, this wasn't in the original. And I'm like... I don't even know.
I will probably listen to the audiobook of The Hobbit.
Yeah.
I liked the, Jess, he was like, yeah, you've never heard of these? Like, some guy wrote these for his son in World War II. Yeah. And I was like, okay, now I'm interested.
The books are incredible. If you watch the movies do a really good job of telling the story, but there's probably in the unedited versions, there's so much more to the books that if you watch the movies, you're like, oh.
Well, and I think what captivated me was knowing the backstory behind The Hobbit and then seeing the parallels of, this would be so incredible to be reading this while you're in the trenches. Like, how, I can't even...
And then you want a thick book, because what else are you going to do? Right?
Yeah.
But I look at that thick book going, I got stuff to do.
I'll listen to it on audiobook.
Yeah.
When I'm driving.
Well, that was a lot about ticks and Lyme disease and all the other thousands of horrible things that could happen to you from ticks.
I'm going to start checking myself, and it's going to be weird if somebody walks in the bathroom and I've got a mirror upside down in my nether regions. What are you doing? Nothing. Checking for ticks.
Are they more prevalent, sorry, one more question, in the summer, or does it matter? Winter?
Well, that's actually why I became more freaked out, because my son got his like in October, November, which is cold weather here. And then when I was at the feed store recently, I talked with a lady, and she said that we're getting them all the time now, and that a woman in the middle of winter, like one of our snow days or whatever, her horse ended up having several on it. So I think what I had originally heard was warmer, more humidish climates, but now...
Well, that makes sense, because you're outside, you're doing more in the summertime, or in the, summertime,
So maybe it's not a climate for the tick issue as much as people being out. So
we need to get a tick expert in here to talk to us.
Yeah. Well, if you like what you saw or heard today, check us out on YouTube or our podcast.
Or visit our website, medicalconfessions.com.